Erectile dysfunction is the earliest sign of a heart disease. Well, guys, let's talk about something that really bothers a lot of men. Some are bold to come forward, others are not. Today, our topic is going to be on erectile dysfunction, ED for short. Erectile dysfunction simply means either you have difficulty initiating erection or maintaining erection to allow you to have penetrative, satisfactory sexual intercourse. The words are carefully chosen. There are people who have erectile dysfunction and their problem is that they cannot get the penis to rise up. The penis has failed to rise up. It has fallen flat. Some of them can make it rise, but it falls back. It is not able to sustain the erection. Okay, the person is unable to sustain the erection to allow penetration, okay, penetrative sex to occur. Or sometimes they are able to get to penetrate but unable to have a satisfactory sexual intercourse. And then we said these people have erectile dysfunction. Now, erectile dysfunction may happen to any man, but typically if these things I've described persist for 3 months or more, then it raises concern. And for you to really understand erectile dysfunction, let's understand how erection comes about. And then we can look at which phases of the erection is affected by this dangerous condition that has affected people's relationship. There are prerequisites. There are things you need to pick an erection. The first thing is that you need a penis. So you must have a penis. And the penis has an erectile body. The name of the erectile body is called corpora cavernosa. This is a structure that actually forms the penis. This corpora cavernosa has small openings that allow it to fill with blood. Those openings, there are small holes in the erectile body called sinusoids. These small holes, when blood fills it, then it makes the penis to erect. So first of all, you need a penis with an erectile body. If you don't have a penis, then you don't have you're not concerned with erection. Okay. The next thing you need is that you need blood vessels that will go to this erectile body. The blood vessels, there are 2 important blood vessels you should know. We have blood vessels that feed the erectile body. We call them arteries. And we have blood vessels that drain blood out of the erectile bodies. We call them veins. So consider the erectile body as a square, maybe a cavity sort of, let's say a balloon. So as you are blowing air into the balloon, it begins to expand. The air you are blowing in is the arteries feeding the erectile body, and then it begins to engorge, and then the penis rises. Then imagine that there is a puncture, okay, to the balloon. The air will begin to leak, and air leaking is the venous drainage. This is important for you to understand how erection comes about. So you need blood vessels. So what it means that these blood vessels must be working. The lumen of the vessel must be open well so that amount of blood reaching this erectile body is enough. The third thing you need for an erection to occur is that you need an intact and functioning nervous system. The concept of erection is also based on your nervous system. There are 2 important nervous systems that are at play when it comes to erection. The first one is parasympathetic nervous system. This nervous system allows you to fantasize, allows you to be able to pick an erection. It allows the penis to rise and become hard. That is what we call parasympathetic nervous system. The other nervous system you need to be able to pick an erection is the sympathetic nervous system. This is actually the nervous system that comes to play when you are stressed, when you are afraid, when you are faced with other strenuous conditions. These are the nervous system that come to play. They are called sympathetic nervous system. But the role of the sympathetic nervous system in erection is that it allows you to ejaculate. So it is important. You need these 2 nervous systems to be functional. So that's the third thing you need. The fourth thing you need is hormones. What hormones? The male hormone. Do you remember the name of the male hormone? Testosterone. Hormones are important for you to pick an erection. You know why? Testosterone, beyond producing sperm, helping the sperm and all that to grow and all that, it also helps you to keep your libido, the sexual desires. Okay, so hormones are important because if you do not have sexual desire, there's no way you're going to get an erection. So you need hormones. The final thing you need to be able to pick an erection is your mind, psychology. Okay, so there is a psychogenic component of picking an erection, and this is most often a problem for many people. Okay, people are anxious, and once you are anxious, you are stressed and all that, the penis cannot rise because the sympathetic nervous system is at play. So having an erection is also a mind game. You must keep your penis up with your mind. So these are the principal things you need to be able to pick an erection. Now, assuming that all the things I have mentioned are intact, then the erection goes through phases. The first thing is that prior to the penis rising up, it was flat. The penis was sleeping. So we say the penis was flaccid, resting. It shrinks and becomes small, right? And really look lifeless. All that it can do perhaps is to urinate. Then you go, that's the resting phase of the penis. From there, the penis goes to what we call the latent phase or the feeling phase. Now look, to kickstart the penis from resting to the feeling phase or the latent phase, something must happen. One, you must have a desire. This desire could be because there is a woman by you. Okay, the woman has exposed certain parts of the body, like the breast, like the private part and all that, and you have seen it and you are fantasizing in your mind and your desire goes up. Immediately, your penis begins to rise up. Is that not it? And that's what we call the feeling stage. What are we filling it with? With blood. We are filling the penis, the erectile body that I mentioned. We are filling it with blood. What blood? Arterial blood is entering it. But you see, once the blood enters, the venous drainage is also coming out. So the penis may be slightly becoming a bit tense, but it is not hard. You should know this. If after listening to this video and you are a man and you study yourself, you'll be able to differentiate all these phases, right? People can get to the feeling stage by fantasizing. Sometimes if there is no woman, they can imagine in their mind and then they get there. Some have to watch sexual videos and all that. No matter what you do, there must be a stimulus to push you from the resting phase to the latent phase of erection, where you've just begin to fill the erectile bodies with blood. But you know, blood is entering the body and blood is exiting, so the penis is not yet hard. The next phase is actually called the phase of tumescence. Okay, this is where the penis now begin to become enlarged, so it begin to stretch out and become enlarged and more firmer, but it is still not rigid. What is happening here is that now more arterial blood is entering the erectile body and less venous blood is going out. Even though some is going out, the amount going out is small. So you are getting more into the penis, less is coming out. So the penis is becoming bigger and firmer. That is the stage of tumescence. Tumescence. At this stage, the penis is firm, but may not be able to penetrate a woman. You may not be able to penetrate. In fact, in erectile dysfunction, some people are able to get penis up to that phase and go back to resting. Some of them are not able to get out of the resting phase. Now, from the tumescence phase, you go to the phase of rigidity. This is where the penis becomes hard, strong, rigid, and can penetrate a woman. And here, the blood that is leaving the penis is blocked, completely blocked. Nothing goes out of the penis. Blood is able to enter, but blood is not exiting the penis, and the penis becomes very rigid. This is what we call the phase of rigidity. And this is where every man who attempts or intends to have a penetrative sex must get to this rigidity phase to be able to penetrate a woman. Once you get to the rigidity phase and you have penetration, then over time, as penetration is ongoing, the sexual activity is ongoing, you get to a peak of excitement, okay, and then there will be ejaculation. And this ejaculation is mediated by the sympathetic nervous system, like I said. So rising from the resting phase through to the latent or feeling phase to tumescence phase to rigidity is by parasympathetic. Then once you get to that phase and you have the sexual activity to a level, it climax, then the sympathetic takes over from the para and then you shoot. What are you shooting? Semen, which contains sperm. It's shot out of your penis directly into the vagina and giving an edge for it to go through the cervix and go impregnate the woman. So once you shoot, the ejaculation happens, which is under the sympathetic nervous system, then the penis now goes through detumescence. Detumescence. The penis begins to become flaccid. Okay, it's now beginning to what? To go down. And what happened? Remember, at the rigidity phase, venous blood is not leaving. No blood is leaving, but blood is entering. So once we ejaculate, now the veins will open again and blood will rush out of your penis. And once blood leaves your penis, the penis begins to shrink and goes back into a resting phase. And you have to wait for some time to repeat the process. So usually women don't understand this. They think that right after you are finished ejaculating, you must pick an erection immediately. No, sometimes some men are able to do it, but the reality is that you go to a resting phase, and then the parasympathetic will pick up again, and then the cycle can repeat. This is how erection occurs. So you will see that for you to have an erection, we need a mind, we need libido, which is from hormone. We also need what? All these things will lead to stimulus, but we also need blood vessels that are open and be able to bring blood into the penis. The penis has to be hard like bone, even though there is no bone in your penis. And then we also need the nervous system. Okay, so this is how erection comes about. Now let's go back to erectile dysfunction. If you have problem with any of these phases and it has been there for 3 months or more, then we say you have problem. Okay, it's ED. What are the causes of erectile dysfunction? The causes could range from many things, but one of the things I would like you to take away from this is that erectile dysfunction is the earliest sign of a heart disease, and this many people don't know. If you begin to have an erectile dysfunction, you may want to check your heart health, your cardiovascular system. In fact, the earliest sign of a cardiovascular disease, look, not just the heart, but the vessels. Your vessels are having problem. It manifests as erectile dysfunction first, even before your eyes come in and before other big organs begin to manifest. So don't treat your ED lightly. Try to check whether your heart and your vessels are working if you have an erectile dysfunction. So that's about one of the things. But many diseases can cause erectile dysfunction. Commonest one in our setting I'm going to mention is hypertension. Hypertension, remember, is a cardiovascular disease. It affects blood vessels. This is important. So people with hypertension will develop ED, erectile dysfunction. Diabetes, it's one of the key. I always say diabetes is a blood vessel disease. Even though it's a metabolic disease which has to do with regulation of your sugar, your protein, and your lipid, the effect is on blood vessels. Okay? So, trust me, many men avoid treatment for diabetes and hypertension with the fear that when they go on medication, they may not be able to perform sexually. But one of the things they do not know is that what may cause them not to perform sexually is the disease itself. Diabetes will destroy your blood vessels feeding the penis. And like I've explained, if your blood vessels feeding the penis are not working, then you are in trouble. Hypertension as well. Atherosclerosis. This is where fat is deposited in your vessels and the lumen of the vessels become very small. That can also manifest as ED. Beyond this, people who have had priapism, okay, sickle cell disease patients who have had sustained erection of the penis pathologically for a long time and then it goes down, it may never rise again. That is priapism, could be a cause. There are other things that may be related, like medications. Okay, I must agree that some hypertensive medication can also cause erectile dysfunction. Certain antidepressants may also cause erectile dysfunction, and a few other causes. But the principal thing I want you to take away from this is check your cardiovascular health anytime you have erectile dysfunction. If you have erectile dysfunction, your symptoms, you are not able to either initiate, okay, or if you are able to initiate, you are not able to maintain, okay, to have a penetrative, satisfactory sex. Okay, I mean the symptoms is glaring. You know exactly that you have problem. Sometimes you may have hormonal problems. Your testosterone levels are low. You may present with erectile dysfunction. Sometimes you may have tumors in your brain. Okay, prolactin, tumors secreting a lot of prolactin and all that can present with erectile dysfunction. Those people don't have even libido. Sexual desires are completely gone. And remember, if you don't have sexual desire, there is no way your penis will get an erection. In fact, another cause is anxiety. Okay, the psychological component of erectile dysfunction. I was in a consulting room, a 17-year-old boy in secondary school, I think second or third year, came complaining that he's not able to have. I said, hey, young man, 17 years, what are you talking about? I examined the genital, everything is fine. I said, hey, you are too young to have this issue. You may have to deal with it psychologically, okay? So, there are a lot of people who have anxiety, performance anxiety. Sometimes they are under undue pressure from women or from themselves to impress a woman, and then they may end up having erectile dysfunction. There are other things I may not be able to mention, but of course in the consulting room you can tell patients that may be causing their specific symptoms. Okay, but psychologically you may have to deal with things. Stress, that's how come when a man is stressed, you put a lot of pressure on the man, they may not get an erection. Okay, so women, if you want your man to get an erection, you may want to, typically calm the man down, right? So that the parasympathetic can take over. Another is chronic kidney disease. So people with chronic kidney disease will present with erectile dysfunction. So then how do we, when you come to the hospital, we take histories, we examine your penis, we examine your genital in general, we do blood investigation, measure some levels of chemicals and all that. And then we also do scan. So we can do Doppler scan of your penile, the penile Doppler ultrasound. That's how we call it. We want to see the blood vessels feeding the erectile bodies to see whether they are intact, whether the lumen are closed and all that. This is important. You can have a penile Doppler ultrasound done, and then once we are certain about what you have, if it's psychogenic, we refer you for counseling. If it is organic, as in the cause is organic, okay, like diabetes, hypertension and all that, we treat the underlying cause, and then we can put you on some medication to stimulate your erection to make sure it's sustained. But most of those medication can only help you to get rigidity. For you to get the desire, the medications may not. So you may have to start the process, the medication will complete it for you and all that. But it's a treatable condition, and you must get to know. In conclusion, erectile dysfunction may be a pointer that there's something much more gravier happening within your body, and you may want to get it checked. It could be a problem with diabetes, hypertension, it may be a problem with your kidney or some other organs in your body, and you may want to have it checked. Thank you for watching.